Hi, I'm Jack Parker here at Parker Cornea. I'm one of the cornea specialists here. And what I want to talk to you about is this condition called Fuchs dystrophy. Fuchs dystrophy is a very, very common thing. We see it all day, every day in our practice. It is a disorder that we often see with the cornea. See, the cornea is the clear front part of the eye, and it should remain clear your whole life. Very often, however, the cornea can become hazy, it can become cloudy, and things can become blurry. The most common reason for that here in the United States is this condition, Fuchs dystrophy, which is a problem with the inner lining of the cornea. There's this little layer of pump cells that keep the cornea clear. And in patients with Fuchs dystrophy, for reasons that we don't know, those cells can wear out. And when they do, the cornea can start to become hazy. This often affects people in their 50s or 60s, but can be younger, it can be older. It's very, very common. Maybe up to 2% of the American population shows evidence of Fuchs dystrophy, and the condition runs in families. So it's very, very likely that you may already know someone else who has this. Fuchs dystrophy, though, is a curable condition. And the way that it's cured in the United States is with a procedure called DMEK. DMEK involves not replacing your cornea. That's the great news. We don't have to replace your cornea. We can fix your cornea almost always just by swapping out these little cells that live on the back. These cells are taken from a healthy eye and then put inside of your eye. They float up and stick to the back of your cornea, and they will clear the cornea up again. This is typically what's regarded as a minor surgical procedure. It's often done in the span of 10 minutes, very frequently in our office. So it's not some big, long, involved, dangerous, invasive procedure. It's usually safer and quicker and easier to do even than cataract surgery. So that's the most important thing to know, is that Fuchs dystrophy is common and curable with this very convenient operation called DMEK. Now, there are a few things that everybody wants to know about DMEK. The first thing they want to know is this a corneal transplant? And the answer is technically yes. We do take healthy cells from a normal eye and put them inside of your eye. But this is not the way a normal transplant is. You know, a normal transplant, a heart transplant, we take your heart out, we put a new heart in. A lung transplant, we take your lungs out, we put new lungs in. With DMEK, we don't remove any part of you. We don't take any part of you out. We just take new cells, almost like stem cells, and put them inside of your eye. We squirt them into the eye through an incision smaller than the eye of a needle. So it's almost like blowing magic pixie dust into the eye to make the cornea clear again. So the technical answer is yes, it's a transplant, but there are no big cuts, there are no stitches that are used on the eye, so it's usually a much safer and easier surgery than even cataract surgery, for instance. What is the surgical experience like? Well, for most people, you don't go to sleep. You're awake. We often do it in the office, but we numb the eye with anesthetic to make it comfortable and give you, if you'd like, an anxiety medicine to make you more comfortable. Something to take either by mouth or IV so that you're sort of relaxed during the procedure. So typically, it's not an uncomfortable procedure. Once the surgery is over, you just sit up and you walk out of the operating room and you go home. Many people wear an eye shield to sleep with for the first few nights after the operation, but you won't be wearing one of those big black pirate eye patches. And the eye is typically very comfortable after the operation. It's common to be a little scratchy, a little watery for a few days, but it's not a painful recovery. The usual downtime from this procedure, we typically tell people to expect 3 days after the operation. That's when they start to see out of the eye. So things are very blurry, very hazy, worse than before surgery for 3 days. And then after those 3 days, things tend to get better every day. Usually by about 2 weeks after the surgery, that's when you're seeing better than you were before the operation. That's when most people turn the corner. Because it takes 2 weeks to really start seeing well, that's one of the reasons why we only do one eye at a time. So you have one eye done, and then once you heal up from that procedure, you can have the other eye done if you need it 2, 3, 4 weeks after that. And another thing that I mentioned before, but just to reiterate here, if you also have another problem with the eye, like for example a cataract, it's very easy to address that at the same time as fixing the Fuchs dystrophy in one procedure. The biggest risks of this procedure relate to healing after the operation. It's very unlikely to have this operation and lose vision. Most of the things that can go wrong after the procedure are not things that cause you to lose vision or be in pain. They're things that cause your healing to be delayed. And every body, every patient, every eye is different. So these are some of the things that we look for after the procedure. The first is we want to make sure that those new cells that we put on the back of your cornea are firmly stuck up against the back surface of your cornea. Usually the critical window of that is the first week or two after the operation. So we'll check you for the first week or two after the surgery to make sure those new cells are sticking. If they're not sticking, either in whole or in part, if they're starting to fall off the back of the cornea, that's called a graft detachment. That's not any big deal when we see that. Probably 1 in 5 people have a little evidence of some of the cells starting to peel away. When that occurs, we don't have to go back to surgery to fix that almost ever. Usually what we do to address that is put more air inside the eye to oxygenate and support and nourish these cells. That's just done in the clinic in a 30-second little manipulation. It's not anything to worry about at all, but we're checking everybody in the first week or two to see whether they would benefit from having more support given for their cells. The other potential risks with the surgery include bleeding or infection, but those are really, really, really rare, but they could occur when you have any operation at all. Lots of people want to know about the issue of rejection. They say, well, if we're having a transplant, could those transplanted cells reject? The answer is yes, they could, but the risk of that is very, very low. It's less than a 1% risk that the transplant would reject. And if it does reject, you don't go blind, you don't lose vision. It just means you need more cells put back inside the eye. So it's something we try to prevent, but it's not the end of the world if you're in that unlucky 1%. The way that we try to prevent it is we have you use steroid eye drops after the surgery. Now, these little cells that we put in your eye, they can't hurt you, but your body can hurt them. So these steroid eye drops make your body play nice with these new cells which have been put inside. You'll use them a lot right after the surgery, 4 times a day for the average person, and then less and less as time goes on. Many people can stop their drops completely after 1 year, but most people will use some kind of drops for about a year after the surgery, sometimes longer, sometimes not as long, just depending on how your body's healing and whether anything else is going on. So I think those are the most important things to know. Those are the most important questions that people ask us. What is Fuchs dystrophy? How is it treated? What's the surgery like? What should I expect after the operation? I'm sure you'll have 1,000 more questions that were not answered during this video. And this video is not meant to be exhaustive or all-encompassing. It's merely an introduction to some of the issues that surround this situation. So thank you very much for thinking about Parker Cornea, for coming here, for allowing us to participate in your care. And we look forward to talking with you more about your particular case and how we can help you achieve the very best possible vision.